Esthetician Review Writing Exam. Ecology. Please like and subscribe. Microbiology is the study of small living organisms called microbes. Bacteria are one called microorganisms that are classified as either disease-producing or non-disease-producing. Non-pathogenic bacteria are non-disease-producing bacteria. Saprophytes are non-pathogenic bacteria that live on dead matter. Cocci are spherical or round-shaped bacteria cells that appear singularly or in groups. Staphylococcus are pus-forming bacteria cells that are present in abscesses, pustules and boils, impetigo, food poison. Diplococcus are bacterial cells that grow in pairs and cause pneumonia. Bacteria reproduce and grow rapidly during the active stage of the growth cycle. Bacilli are the most common form of bacterial cells. Bacilli, rod-shaped organisms which are the most numerous and most common, produce the tetanus, diphtheria, tuberculosis. Spirilla, curved or corkscrew-shaped organism that causes syphilis and Lyme disease. Bacilla and Spirilla are able to move themselves by using hair-like projectors known as flagella. The normal dormant stage that bacteria enter when the environment makes the bacteria survive difficult is called the inactive stage. A submicroscopic infection agent that replicates itself only within cell of living cause is called a virus. HBV is a highly infectious disease that affects the liver. Acquired immunodeficiency syndrome is a highly infectious disease that interferes with the body's natural immune system. Head lice, itch mites, ringworm, and nail fungus are all diseases caused by external parasites. The growth of a parasitic organism within the body is known as an infection. Blood-borne pathogens are bacteria or viruses that are transmitted through blood or body fluids, causing infection disease. Tuberculosis is a contagious, potentially fatal infection caused by airborne bacteria that first affect the lungs. A contagious disease refers to a disease that is easily spread from one person to another. An infection present in a small, confined area indicated by a pus-filled boil, pimple, or inflammation is a local infection. Immunity is the body's ability to destroy infection agents that enter it. Passive immunity is the stimulation of the body's immune response through the injection of antibodies. Efforts to prevent the spread of disease and kill microbes are referred to as infection control. Infection control procedures are divided into three levels of sanitation, disinfection, and sterilization. Hives, itching, and swelling all indicate an allergic reaction to latex. Sanitation is the lowest level of infection control. Antiseptics are products used to arrest or prevent the growth of microorganisms on the skin. Efficacy labels are required on all disinfectants and inform the users about what organism the product is effective against. Washing your hands with a liquid antibacterial soap and water is an example of procedures used during sanitation. The second level of infection control that does not eliminate bacterial spores is called disinfection. Instruments can be pre-cleaned using high-frequency energy waves. The 2001 OSHA bloodborne pathogen standard requires the use of an APA-registered disinfectant. OSHA is the regulating agency that enforces safety and health standards in the workplace. A safety data sheet provides key information that may prove helpful during an allergic reaction related to product usage. Key information on a specific product regarding ingredients, associated hazards, combustion levels, and storage requirements is provided by the SDS. Sponges and disposable films are porous products used in the skincare center that cannot be properly disinfected. A covered container is required for storage of disinfected implements. The process, referred to as double bagging, is performed when a blood spill occurs. It is important to wear gloves to protect your skin when mixing chemical disinfecting agents. The level of infection control that destroys all small organisms, including bacterial spores, it's called sterilization. Tools and instruments used to puncture or invade the skin must be sterilized or disposable. A UV light sterilizer machine uses UV light to kill bacteria in a dry setting. A steam autoclave machine uses pressurized steam to sterilize critical implements. A chemiclave sterilizers, surgical instruments with high pressure, high temperature vapor. A bleeding wound should be treated by covering the wound and applying pressure. An electrical burn is usually the result of faulty equipment or improper use of equipment. Determining if the victim can talk or cough is the first course of action taken if it is suspected that a client is choking. If a fainting victim does not regain consequence immediately, the esthetician should call 911. Steps taken in the event of a cut, scratch, or embedded object in the eye area: place a gauze pad or clothes over both eyes, secure a gauze pad or close with a bandage, and get to an eye specialist or emergency room immediately. Thank you. Please like and don't forget to subscribe.